Shay, when do we normally kick these things off? Well, I don't know how long we wait.
Whenever you want to. We have about 22 participants minus us two, so 20. We had 60 register, so we can give it a few more minutes if you'd like.
Okay.
There we go. People are jumping in right now, actually. It's climbing. The numbers are climbing.
So you all can see, Shay, give me a thumbs up. Can you see my screen?
Yes, I can see your screen.
Okay. And then Shay, can you be my fourth partner? When there's questions in the chat, I want you to interrupt me with those questions.
Okay, not a problem.
All right. So you can see on the screen is a fun little thought exercise. We're actually going to solve this problem before the end of this webinar. So you've given up your Ryan White job. You're the manager of Southern Chicks. No relation to Chick-fil-A. Don't sue me. I forget that this call is being recorded. And imagine that you're in this position, right? What would you do? I've presented at least 4 options for you, something to think about. And again, this presentation hasn't kicked off yet, just a place for those brain juices to start flowing.
I love answer D.
That was me for a while. I went and joined the DC Health Department, joined and worked in the recipient. That was a real good time.
Yeah, I wouldn't necessarily call working for local government a zero stress job. That's all I'm saying.
Yeah, that's poor advertising. I should have said low stress job. How about that?
Coming from New York State Department of Health, not sure that's what I would call it.
All right, I hope everyone is doing amazing today. Thank you so much for joining. I think we're going to get started. It would be great for a couple of folks to just unmute yourself and tell me. I met a few folks before this call started, but tell me, your name, where you're from, and what your experience is with lean. I know nothing about it. I'm a master black belt, somewhere in between. Or you know what? My even favorite thing to do, I'm going to pick on some folks. Angelica B. Do you want to unmute yourself and tell us a little bit about your experience with lean, if at all?
Hi everyone, I'm Angelica Barrientos. I'm the MUTV Epidemic Program Coordinator in and I've had some experience with just like in a hospital setting.
Okay. Right on. Thanks so much for being a brave volunteer and sharing a little more. How about you, Preston? Where are you from, and what's your experience with lean?
Yeah, I'm in Atlanta, Georgia. I work at Positive Impact Health Centers. I have no experience with lean whatsoever. I was forwarded this training from my manager. So
Right.
here I am.
Okay. Thanks for the honesty. I appreciate it. This is a safe
Yep.
space. And we're going to make this relatively painless, I hope. There's one more volunteer I forgot that I needed. Is anyone here working in a clinical setting? Like you see an exam room at least once a day. Is that anybody here?
I see a exam room once a week, have clinic once a week.
Okay, Kathy, you're going to be my last volunteer.
Okay.
There's a real easy question coming up, and I just find it's easier to have someone prepped and ready rather than waiting for some time. All right, so thanks everyone for joining. I want to talk to you today about making lean personal. My name is Khalil Hassam. I'm a CQII consultant. I want to offer you a very important disclaimer. I'm trying to teach you at most one thing. This is really not intended to be a didactic session. There's plenty of places online to go and learn about Six Sigma and the details of lean and figure out all these textbook definitions. I want to just show you. I want to inspire you. I want you to walk away from this talk with an idea of how to actually dig in. Shay, could you help me out? And oh, perfect. Thank you so much. And Shay, can you launch this poll for me? So here's the scenario I want you to imagine yourself in. If you were here for before the slide started, there was a scenario about being a manager at a Southern chicken restaurant. This is another one. So this was me a couple of years ago. I lived in an apartment at that time. And the
sorry.
apartment,
I don't mean to interrupt,
yeah.
even though you want it.
Yeah.
Somebody must have logged in with our main account and took the poll from me. So we're playing find the poll. So
No problem. I got it, Shay.
okay, thank you.
You see a poll on your screen?
No, I
Yeah.
don't. That's why.
You
Okay.
don't. Okay, but I'm seeing some thumbs up.
Okay,
in the chat.
good. Thank
Yeah,
you.
the poll's there.
I see the poll on my screen.
Thank
You
you,
guys are the
Preston.
best. Thank you.
So this was me. I had 4 bulbs in my apartment, 4 lamps that I needed to buy bulbs for. The apartment was managed and they took care of the rest of it. So I'm going to show you what you see here on this screen. That you can buy 4 bulbs, but oh my God, they're $2.24 each. What a ripoff. It's insane. Or you can buy a pack of 24 bulbs from Amazon. They're both from Amazon. Let's assume that they're equal product, equal whatever, same wattage, same everything else. And they're more expensive total, but you're spending less than $1 a bulb. And I'm going to ask for one brave volunteer to come off mute and tell us why you voted the way you voted. I'm just curious.
I can go. I picked the ones on the left mainly because I know I don't buy light bulbs that frequently, and it seems like when one goes out, they all go out. So I would rather have more personally on hand than and spend more at the one time to have them all.
There we go. Thanks, Mara. I'm going to clarify here too, just in case. All your bulbs went out, right? You're buying all 4 at once, or all 4 of your bulbs went out. So you were buying 4, whether that's you want to buy extras or you just want to buy the 4.
I'm gonna go. So just because I said the other answer, so I want to give a contrary view. I live in a tiny studio apartment in New York City, so I do not have space for extra stuff. So I'm just buying what I need, even if it costs more.
Thank you, Andrea. I love it. We got both sides of the fence. Really helpful.
This is Al. It could go either way because they're not exactly the same. That's the thing. One says 4,000 K light wave. That means it's going to be a little bit wider light for the ones on the right. The ones on the left is going to be more yellowish. So it depends on what you're looking for. If you're looking for a more ambiance kind of thing, then you get the bulbs on the left and you get a bigger deal. But you're not getting the same bulb because they're completely different bulbs. One's A19 and of course the other's the A29. So they're different equivalents. So it really varies upon what your need is. But as far as lean wise, and you're trying to buy the most for the best bargain, then of course the one on the left is going to give you a better bargain.
Thanks for sharing, Al. I love that. Al is too smart for me. Getting into the details of the bulbs. I'm just like a dumb business guy over here. Thanks for expanding my thinking, Al. I love it.
But also, can I just jump in? Because I deal with this all the times at like grocery stores and stuff. Like, yes, an individual bulb is cheaper on the left, but like, if you're on a budget, if you're somebody that works, say, for a health department or something, like that one on the left is 2.5 times, no, almost 3 times more than the one on the right. And if you're on a budget, like $23 is more to spend than $9. So the one on the right can make a lot of sense to some people just because you're spending less money to get that one thing you need, basically.
I love it. This is so helpful. So what I heard so far, a couple of thoughts that we're going to come back to. We're also going to, I hope that we solve this problem where that your thinking maybe is influenced. This is what I mean by lean, right? We're going to talk about how I changed buying bulbs from lean. I heard it's lean to buy cheaper bulbs. I heard I don't want to deal with inventory. I heard I have to spend money I maybe don't have or don't want to outlay for a cheaper product. So some good thoughts. So 70% of us think we want to buy the more expensive product. Sorry, outlay more cash for $23, but buy cheaper bulbs at the end of the day. Again, we're going to come back to that one. Thanks for indulging me. So learning objectives. Where do I hope you are by the end of this call? 1, you're going to know what the heck lean is. That's really simple, I promise. 2, I'm going to give you your improvement superpower. This is the one thing I want to teach you. Remember, I told you I'm only want to teach you one thing. This is if you walk away learning one thing, that's it. It's your improvement superpower. And then I want to show you 10 plus examples. I just want to inspire you. I want to show you what it looks like in the real world. I'm going to give you a little bit of table setting though. I've been in this game since 2009. That's when I joined. 2008, 2009 is when I started getting involved in Ryan White. 2011, CQII and HRSA came to town and launched a cross parts collaborative. I got involved from day one. With my fantastic friend and colleague, Justin, I ended up being the co-lead of the response team for the DC EMA. I was working in a clinic the whole time. 2019, I joined the health department, started developing a roadmap for lean culture with Justin. COVID interrupted that, and then moved on to another position. And then in 2022, I got my Lean Six Sigma black belt. Why does any of that matter? Because if nothing else, just believe me that I've been doing this game for 13 years, and out of everything I learned, despite all the structure and project management and change management and the triple aim and Ryan White, I never cracked the code on how you get people involved in quality. It always seemed like it was me, and maybe you feel this way too. It was like me and 4 other people at my clinic that cared about it, or me and 2 other people at the recipient that were passionate about quality, that were just like carrying the cross of quality for everyone. And what's missing in this is engaging everyone every day. How do you get quality to be approachable so that everyone says, I know something quality that I can do tomorrow. I know some way I can apply quality to my world. For me, the answer to that is lean. And I'm going to show you. A little bit more of important table setting. You have to use a defined approach in your Ryan White setting. These are the requirements. You know them, you love them. But again, a defined approach. Why is a defined approach important? It's because throwing spaghetti against the wall and seeing what sticks isn't really that helpful. When you understand and apply and follow a system approach to quality, you're going to have better documentation, you're going to improve quicker, and you're less likely to have your gains backslide. You're more likely to sustain and even better scale your successes. So this is the important aspect of a defined approach. There's a ton of them. There's model for improvement, there's Six Sigma, there's team steps, there's agile. I want to briefly cover 3 today. 1, this is the model for improvement. There's 3 questions and you run PDSA cycles. I'm assuming you know it, you love it, you've seen it 100 times. There's Six Sigma, which is, you may have heard of Lean Six Sigma. This is the other side of Lean. You don't have to do Six Sigma to do Lean. And again, this is the only chart you're going to see today with crazy looking stuff all over. This is a control chart. Six Sigma is about reducing variation through statistical process control. That's all you need to know. We're not even going to cover it today. I just want you to know that other models exist. And ding, 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 here's the answer to the first question of what is lean. Elimination of waste. That's it, just eliminate waste. When you eliminate waste and you can have a process that is 0 waste, that means it's perfect, and you're delivering perfect value to your customers. You do that through continuously improving everything. And I mean, literally everything, from the way that you log in and send emails to the way that you greet customers and understand their feedback. It's the whole gamut. You might be asking me, how does this connect, or is it just completely divorced from model for improvement and root cause analysis? And I went to that training on driver diagrams. They're connected. Root cause analysis helps you, let's say, understand where exactly you should be applying your lean efforts. Driver diagrams at a system level help you understand where you want to start applying your lean efforts. So they influence each other, not to worry. We're not going to cover it today, but I want you to know that lean does not live over here in a vacuum. So 2 ground rules. And I have my accountability partners, Sarah, Mark, Mara, and Kathy with me. 1, lean is simple. That's it. And 2, you're my customer. I'm here to serve you. Lean is about, again, delivering perfect value to my customer. If you wait until your questions are at the end, someone else is going to miss out on that learning. If I'm going too fast or too slow or something I said was confusing, you're missing out. I'm not giving you the value that you deserve. So we're going to try that with, I'm trying something new. We have 3 volunteers, Sarah, Mark, and Mara. Can we try this once? Come off mute all together and interrupt me in some way and tell me I'm going too fast, too slow. You had a question.
Sorry for the background yelling.
There we
You
go.
might hear from me. I think you're going at a good pace. I talk fast, so I'm keeping up well.
Hi, Khalil. I think you're going at a great pace, and I'm excited to hear how lean is simple.
Okay. So I asked 3 folks to help be accountability partners because I want you to do the same thing. I can't see the chat. I'm not going to read it. Although Shay, I think Shay or Dennis will read them out to me and interrupt me if they
You're
come
good.
in. Yeah. I would really rather you just interrupt me, unmute and just barge right in. So Sarah, Mara, and Mark are here to help be the icebreakers on that. But I want you to feel empowered. I'm here to serve you. So tell me if I'm not doing my job. So, oh, I think I was a slide behind. Sorry about that. My goal, you're going to see waste. This is your one improvement superpower. And I'm going to show you 10 ways to banish waste from your world. I want you to walk out of here feeling like I know how to apply at least one of them. So let's dive in. And Kathy, are you ready and with me? My one clinical expert, at least one on the call.
Ready?
Does this look familiar to you?
Yes.
Can you find the tegaderm?
Yes.
Okay. Can you find it now? If we
Yeah.
ignore the dumb red circle around it, sorry about that. I couldn't put that out.
Yes.
Is it a little easier to find it now?
Yeah.
Okay. Think back to that first picture. Imagine it's your responsibility to do QC on these push carts. Tell me what's missing.
Can we go back again?
We can go back. We can go back to this.
The Band-Aids.
Band-Aids. Okay. Anything else missing?
Someone said the gloves.
Someone said the gloves. Awesome.
Yes.
Thank you, Dennis. Thank you for chiming in and interrupting. I love it. Keep it going. I'm going to tell you this. How about now? Is it easier to tell what's missing? Do you
The
even have?
labels, everything has a spot.
Yeah.
And if it's missing, you'll notice because it would be empty in its spot.
You don't even have to think.
Right.
In
The
two-
pictures on there too,
Yeah.
showing like how many, so you can easily see the sterile water that 2 of them are gone because there should be 6.
Imagine you're new to this job, or you have to train someone that's new. This is like creating a standard. So easy. This is what lean looks like, at least in a Ryan White clinical example. And you're going to tell me, oh, I am concerned. This is just fancy organization. I don't believe you. This is some Marie Kondo trick. And I'm going to tell you that organization alone is not improvement. This looks organized, right? What's actually happening behind the scenes? Right? This looks beautiful. Oh my God, look at all these fantastic palettes. They're all organized. Everything is clean. But by the end of this call, you're going to come back and say, no, no, no. None of that was lean. Just because you're organized doesn't mean that you're being lean. You're going to see waste, and I'm going to teach you waste, right? That's my goal in this talk today, is to teach you the 8 wastes of lean. So if I'm going to teach you one thing, this is your improvement superpower. Once you learn to see waste, your life will be different. These are the 8 wastes of lean. The eight deadly sins. So thinking back to our example of being a manager at a Southern fried chicken restaurant, right? What could you do? You could make too much food in anticipation of all the people that are coming. So I anticipated the lunch rush, and now I made a bunch of extra food. But there's not enough room in the kitchen, and I need to take it out front and under the hot lamps. And then my extra food is just sitting there in the inventory. And then you get a guy like me who comes to the front and says, I want a spicy chicken sandwich, no pickles. But there's pickles on that sandwich. So you have to send it back to the kitchen. Someone opens it up, which now we're over processing. You got it wrong the first time. That's a defect. Now you have to remove the pickles from the sandwich. You're doing something extra that I'm not here to pay you to remove pickles from my sandwich. Someone is spending their time and doing motion to unwrap a sandwich and take out that pickle. By the way, that nasty pickle juice is still all over the sandwich and it's been ruined. And I know this because Chick-fil-A sometimes does this to me and it's gross. I'm meanwhile waiting for my sandwich, and Al, the amazing employee of Southern Chicks, could be improving the kitchen, could be learning Spanish, could be doing something fantastic with his time, but all the while he's doing all these extra unnecessary tasks. These are the 8 wastes of lean. Now, what does that actually look like in a Ryan White setting? Overproduction is anything that's extra or before request. So if you're working at a health department That means that you're calling providers before they're ready. You might have a direct feed from the lab company and, hey, Dr. Winkler, we got Billy's 4th gen positive test. And Dr. Winkler saying, I don't have that lab. I don't know what you're talking about. You could be making a patient portal reference document that's 17 pages long when really they didn't want that. No one's going to read it. Or you could be making too many hamburgers. You're not open when your customers need you. Right? And I'm not blaming anyone here. I've been a clinics op guy before. I was responsible for managing clinical schedules. It's hard enough to get clinic staff during the day, let alone during COVID. And I'm not blaming any of that. What I'm saying is if we take a step all the way back and say, when do patients want to see us? Especially think about people in the Ryan White community, people with HIV who are below 500% of the FPL. Can everyone negotiate time off with their boss? Can they always get sick leave? Can they go to a doctor's appointment in the middle of the day, who, by the way, never runs late, gives them exactly what they need, and they walk out of there on time in 20 minutes with everything that they wanted? How many of our customers can do that? So overproduction is, not being there when producing too much before our customers are ready for it, which is really just clinic staffing hours. You got transportation. This is unnecessary movement of supplies and people. So I remember we were working with some folks who said, I have to go to a provider's clinic at the health department. They were at the health department because I can't get remote access. So I have to schlep my way across town and go see them. Think about the temple that is medical care. People have to come see me in my clinic. We don't do a very good job with remote access. And I'm a primary care guy, so I have a soft spot for this. We just print out a gazillion encounter summaries and say, go take this to your gastroenterologist. Good luck. Why couldn't we just send it electronically?
Kahil, Mark has a question.
Thank you. Mark, jump in. I appreciate it.
Yeah, this is all fascinating for me, but your introduction was you don't want to just get people that are really interested in quality. You want to get people interested in quality that didn't know what quality was.
Yeah.
And I don't see the motivation, if I'll learn this, but I want to first of all know what is it that's going to grab people and say they want to learn it too.
Thank you for keeping our promise and jumping in, Mark. I appreciate that. I'm going to show you by the end of this call how I used to spend 5 business days a year writing emails, and I turned that down to a half a day using Lean. I'm going to show you a bunch of examples, and we're going to come back and connect these wastes. So that's what takes it from, oh, I learned this life hack on BuzzFeed, or like my wife sent me this Instagram story about how I can better organize my pantry. Like that's like a one-time thing that you do. So I'm going to show you a bunch of those one-time things, but these are the secret sauce behind how you start to recognize more of these in your own world. So I hear you, I'd say wait until the end of the hour and then come back and give me that accountability check at the end. And if you still feel that same way, then I haven't done my job and I got to figure out what I need to do differently next time. Is that fair, Mark?
Sure.
Thank you for placing some trust in me. I appreciate it. This one was horrendous. When I used to work in a clinic, people would hoard supplies. They would hoard butterfly needles and they'd hoard specimen tubes. I see some people nodding on the call. And it's because we have an inventory issue because we don't get enough. And then did you know that those lab tubes that they put your blood in expire after a year? And then when LabCorp says, why do we send you more? We just sent you 500, but you only drew 250. We're not sending you anymore. Then you have to buy them on your own, and it's a whole big thing. And it's because you have poor control of your inventory or work in progress, right? You have more case managers. You have not enough case managers, too many cases, and people are leaving because there's too much work in progress. Anything that's not done right the first time is a defect. So if a clinical provider misordered a lab or misdiagnosed someone and someone needs to come back, that's an example of a defect. You have duplicate medical record numbers, that's a defect. You got to go back and fix it. We don't cast blame, right? We all are quality people. We don't blame the person, we blame the process. There was a failure of process that led to Megan Elmore, the front desk person, making a duplicate medical record number. It's not her fault, but there's waste in the system as a result. Over-processing is anything that the customer doesn't want to pay for. Do you want to be paying for someone to be fixing the food that you just ordered that they should have done differently? Do you want to be paying for your physician to be doing telephone encounters when it could be a nurse or a PA or an NP? Do you want to be paying for people to not be working at the top of their license? These are all sort of some examples of over-processing. Anything that's extra effort. This is a good one for the Ryan White world. I bet you at least one person out here has, and one is being conservative, has a service category where they have a separate intake form and it asks similar questions or the same questions that were already asked in a different intake form for like the main clinic. And you're asking that person the same question twice and you're not going to do anything with it. That's an example of over-processing. Jennifer, did you have a question? Motion. So if there's anyone who deals with an EMR, you know what extra motion is, it's extra clicks. Or imagine, I used to see this in the phlebotomist office. Some supplies would be here, she'd have to bend down, the centrifuge is on the other side of the office, unnecessary moving around. Or Kathy, who's in clinic once a week, might be thinking about, where's her medical supply closet? How far do I have to go to get new supplies? I'm walking around, you may think I'm getting my steps, which is a fantastic attitude, but it's unnecessary. You didn't have to be doing it if things were optimized. And waiting, we all know what waiting, it's literally called the waiting room. By the way, there's a clinic called Virginia Mason in Seattle, which has applied lean so ferociously that they've started eliminating waiting rooms from their clinics. No more waiting rooms. They just figured out how to get their pull system on. Like just a completely shocking thought. Staff on hold with the insurance company waiting for a prior auth. I'm on hold for 60 minutes. Clinicians waiting on labs to start treatment. This is all treatment. And then this is my favorite one. This is all of you, all of us. Anytime that you're not working on what you're there for, the maximum of your talents, when managers aren't listening, when the structure isn't set up for people to spread their good ideas, we're losing human potential. So those are the wastes. That's the end of my didactic session, I promise. To recap, there's overproduction, transportation, excess inventory, defects, overprocessing, wasted motion, waiting time, and wasted potential. Now we're going to get into the fun part of things. I'm going to come back to this example. So you're a manager of a really popular fast food location. You could make a bunch of food ahead and store it under the heat lamps and it'll be ready for the customers. I hope you all know by now this is a trick question. Right, this is literally everything that's all of the wastes that we talked about are in there. You're making too much, you're having to move it around. What about doing nothing? What if we want the Instagram influencer subscriber model? Someone tell me why this is a good idea. Longer lines or bigger hype, right? Anyone want to come out to bat for that idea?
Wasted time?
Wasted time.
Waiting time.
Waiting time. Thank you, LaQuanta. Waiting, you nailed it. And over-processing. And there's something else which I won't get into, but it's the voice of the customer, right? We're here to serve those people. What about get corporate support, conduct focus groups and customer surveys, and develop a solution to launch next quarter? That sounds pretty good. Who likes this idea? Who likes this idea when you get your bonus check? I'm sorry, that's the most important part I forgot about.
I like this idea, Khalil, but what about the employees? What about bringing them together as a team and forgetting about the work part and connect them as people first, wanting to be on the same team to providing everything in a more productive way and incorporating that into letter C?
Let's say we did that too. So corporate support, focus groups, internally, externally.
Yeah.
All of that is the right idea. The only thing that's missing in here is next quarter. We all, I hope, know better than that because it's the rule of one. What can I do by next Tuesday? How do I do rapid cycle improvement? I'm not waiting to launch a solution for next quarter when it's advantageous. I need to be in the mix today, tomorrow, next week. Obviously, quitting your job and working at the local health department, A+, 100 out of 100 answer. Anyone have an idea on what the real answer is, what the lean answer is? What's it? Someone tell me what the definition of lean is.
Eliminating waste.
Nailed it. Is it Jean or Jean? Either way, Jean Taylor, thank you. Yeah, eliminating waste. So the answer really is
Gene.
Oh, sorry, thank you, Jean. Or maybe I'm sorry, that was Chris.
Yeah,
Someone
he
else-
said it first.
Chris said it first. All right. So value stream map, which we won't get into, train your employees, going back to Sarah's idea, and then ruthlessly eliminate waste. That's really the lean answer. So you've heard of Schrodinger's cat. Here's Schrodinger's USB. No matter how many times I stick that USB in there, I always get it wrong on the first 2 tries. You might say, oh, come on. And I'm going to tell you that's a form of lean waste, right? This is trying multiple configurations until the USB fits. Someone tell me what lean waste that is? Does anyone know?
Overprocessing.
Overprocessing. Motion and overprocessing. Nailed it, LaQuanta. Thank you. Taking more than one try to get it right, meaning we didn't do it right on the first time. What's that a lean waste example of?
Amy Croft said effort, but I'm not sure if it was for this question or the other one.
Is it defect?
Defect. Amazing. Thank you, Jessica. Yeah, it's defects. So how now, Mark, you're going to start holding me accountable if I go in the wrong direction after this slide. This is what lean looks like. You're going to say it's so silly. I'm going to say, yeah, that's the answer. Lean is simple. I put a colored dot on the side that needs to go up. Worked fantastic. I have a visual signal, so I know which side is up. I have less defects, less overprocessing, and I've gained 2 seconds a day to learn Spanish. So I can say, mi nombre es Khalil. So there's my human potential. The problem is though, 1 in 5 times I'd still put it in the wrong way. So what did we say in that one of those earlier slides? Continuously improve everything. Continuously improve. So I put an X on the other side. You're going to say, oh, that's like some life hack. And I'm going to tell you, no, this is lean visual control. These are the things that you're feeling, that you're seeing other people do. There's a lean name for it. There's a structured way to apply it. Like many of you was impacted by the COVID-19 pandemic. I worked at the health department at the time, and so went and served on the COVID-19 response. There was a day shift and a night shift. And every day I would have to go up to the 6th floor where the EPIs were and have to assemble my desk. Because like I said, day shift and night shift. So I'd have to take all this stuff here, this and this and this and this and this, and figure out where it belonged to. And so when I'm looking straight on at my computer, I would say, it's sort of hard. Where does that USB go? Does it go here or here or here or here or here or here? What about here? Does it go here? Maybe here? No, the last one's, that's the charm. Again, real simple. No struggle, visual control. I put little sticky dots where everything goes. And you can see it's real simple. I know where things go. I don't have to overthink it. Coming back to that clinic exam room example, you would say, oh, it's just like you put some pictures together and you put boxes where things go. Lean can be as simple as that. So more importantly, I think this is the human element. This is where we come back to Mark and others' questions about how do you get lean? How do you get people to care about quality? I took an activity that was a real pain in the rear for me. I did not enjoy doing this. And I reduced the waste and I made it a joy every day. I almost made it fun to come in and connect the color dots. Here's a fun one. I used to make, when I was a quality improvement coach, I used to make a sign and visit sheet for every visit. You can see here. I would specify to the organization, I would write the date. And this is embarrassing. I would be at a site visit sometimes and tell them, oh no, can you please print this sign-in sheet? Making a custom sign-in sheet for each visit is an example of overprocessing. Does Sally at the FQHC care if I'm writing a custom sign-in sheet for her, Or would she rather me spend my time doing quality coaching for her, reviewing her data, coming out and doing a Gemba walk, and sometimes forgetting it at the office? That's an example of a defect. You could say, Khalil, you're a terrible human being and you're the worst professional I've ever known. Or if we're all quality improvement folks, you'd say, no, this is a failure of process. I made a site visit go bag. You can do the same thing too. So I went from a really complicated custom sign-in sheet to one that's adaptable. There's this principle called just in time. I said, why am I writing my name every time? My name doesn't change. My email address doesn't change. I put it into my bag with a bunch of other things, all the same resources I use. And there's that little thing there saying, print more copies of site visit materials. I'd have a copy of the PCN and a local breakdown, and here's performance measurement, here's what you need to do. And instead of every time having to go in and count, oh, I have 2 left, I have 1 left, I just put a silly little sign that says print more copies. I don't even have to think about it. So I always have this stack in my work bag. It's called just in time. I have a sign card there telling me what I need to do. That's called Kanban. And things are set in order, which we'll cover in a second. So this is how you make site visits easier. Lastly, I use my brain, not my wallet. That's one of those great quality quotes. This very nice rep from Aflac came, and I had to attend a session, and I took that binder, and instead of going and having to purchase some fancy one, I just put a white piece of paper over it and made my own. You repurpose what you have in front of you. You use as little resources as possible.
So Kahil, just to interrupt, it's
Yeah.
funny, your process for site visit is my exact process when I used to work at my old bureau. That's exactly how I prepared. I had all of that. So I was doing lean without knowing I was doing lean. So I was just excited to see that. That's
Love
all.
it. Love it. Thank you for sharing. Quality improvement is intuitive. You guys are all practicing it. It's just that lean is a defined approach way to practice it a little more structured and to do it more and more. I'm going to show you how I made dinner faster, and maybe in the long term made my wife a little happier. So this is how I would make dinner. If I'm making a salad, I got to go find my bowls in the back. And I have all these wastes. I have too much equipment. I'm moving old bowls and lids around. My wife is waiting for dinner, not very happy. And I'm over processing. I'm having to do all this extra work I didn't need to. If I'm cooking eggs, it's real easy, right? There's my fry pan at the front. We eat a lot of eggs in my family. Reheating soup, no problem. And because I'm Indian diaspora, we make a lot of curry. My wife's from the Philippines, curry ×2 in this household. I got my pot, my other pot, everything's right there at the front. So my stuff isn't really where I need it. How do I BuzzFeed, Instagram, Marie Kondo my kitchen, but in lean? There's an actual structured way. I'm not really trying to teach you 5S. I just want to show you that this structure exists. I think how to 5S is the concept of like an entire other call. Something called 5S, which stands for sort, set in order, shine, standardize, and sustain. It's the 5 steps you do. So in this case, sort is sorting through all the items to figure out what's helpful to me and what I don't need. Setting in order is I put the most frequently used items, what do I need, right next to me, and the other stuff I don't need. Like, why do I have a stock pot at the front when I make chicken stock? I mean, realistically, like once a year. I'm going to leave it better than I found it, which is shining it. Things go back in the order. I have to standardize it because if I didn't include stakeholders, AKA my wife in, then as soon as she comes in and unloads the dishwasher, it's going to be back to square one. This is like every single QI project that you did where you made a new process. People didn't necessarily buy in or get trained or follow it. And then you go back and look 3 months later and say, hold on, why is our viral load suppression screening rate, why is my urinalysis collection rate back to 82% when we were at 90? It's about standardization and sustaining. This is all the garbage I had underneath my kitchen island. I had 7 skillets. 2 of them I liked, 3 of them I didn't. I thought I would be this big fancy cast iron guy. Turns out I wasn't. I don't use it very often. I had 8, what am I doing with 8 pots? I liked 4 of them, 4 of them I didn't. And I had a bunch of other bowls, some I liked, some I didn't. So I then sorted it. I got my good stuff, I got my less used stuff, I got my donate, and then I got my other things. I had a bowl that I shattered and I kept the lid for. Why? If you're wondering what the corollary to your life is, go look under that drawer in your desk. Go look in your kitchen at what I would call like the drawer of death, where everything just goes. Soy sauce, old salt and pepper with a fork. 4 years ago, Metro Pass that doesn't work anymore. Maybe like 7 dead batteries. You could 5S that drawer. So here's what it looks like set in order and shined. Looks a little different. And then now we come back to sustaining. What goes where? Shay, I'm gonna call on you. How do you know what goes where here?
Depending on usage, like what do
Depending
I
on
go to more often?
But what's the chance you're gonna get 100% right? The way I wanted it, the way I set it up, the way the process is done. Do you have any instructions here?
No,
No.
that's true.
Right. And you're going to tell you, I see some laughs. Thank you, Preston, for laughing. I love it. I love to see the smiles. Again, lean is simple. I wrote bowls, Pyrex, and salad. I hope by now you would think the fact that I have to read that is unnecessary. That's a waste of over processing. So I made a circle and it looks like a pan. So, you haven't had your cup of coffee. You were up all night, serving soup, and you came home at 4 in.the morning. Couldn't remember when you're unloading the dishwasher where the pans go. That's where the pans go. Lean is simple. My lean is simple. Lean can be complicated, but my lean is simple. So it says it, and it also, you have visual control.
And
Here's
I
one.
just wanted to say, I wasn't laughing at you. I was thinking of the movie Sleeping with the Enemy with Julia Roberts, where she's married to somebody that has OCD, that has like labels on the spice racks, and he like hits her if she doesn't keep the spice bottles label on the outside so that he can see it. And she just like doesn't really care. That's what I was laughing. I was like, oh, this is going to turn into some Sleeping with the Enemies.
No, definitely not. My wife and I have a very loving relationship. Lean is about constant communication.
Of course.
Data digestion. I promised there was only going to be one graph. This is a fun one. Imagine if every one of your graphs was as simple as this to read. Do you even have to read the axis and the title at the bottom and anything else to understand whether or not we're doing better than our performance goal? Can you easily, quickly see with visual control and on red, yellow, green? It's literally written right there. We want to be above this line. When we're red, we're below it. When we're yellow, we're getting close. When we're green, we're next to it. I know some of you on this call probably have really highly advanced CQM infrastructure where you're publishing your measures to your customers in your waiting room, or you're doing a newsletter, right? Imagine how do you communicate complicated ideas or technical information in a really simple way? Anybody can come up and read this and say, I can see that they're doing well. I can see that they're above or below this line. I understand how far they are. My dream is you're saying, Khalil, this is so silly and simple, in which case, yes, you have fallen into my trap. You're ready for a more advanced lean training, but this is where lean starts. This is how you get people in. This is the beginning. So we're going to come back to this example of my house. And I'm quite curious to see, we had a 70-30 split before, 70 bulbs on the left, 30 bulbs on the right. Let's see if I can't launch this poll again. So old versus new you, meaning old you at 4:01 p.m. and new you at 4:44 p.m. Let's see. Let's launch this poll, and I'm fascinated to see if any results have changed. And then we're going to take this and we're going to break it down in terms of lean waste. So coming back to Mark's example, why did I spend 15 minutes droning on about lean waste? It's so that you can start to recognize the waste in all of this. And there, granted, there are some other considerations to be had about, do I have the money for it? Or, other questions that are not necessarily lean. Lean is not the only answer. It should influence where you're going. All right, we're at 37, 39. I'm going to end the poll. Let's share the results. Shay, give me a thumbs up if you can see the results being shared.
No,
Awesome.
but I'm the host.
Oh,
of
thank
the
you.
other
That's
team.
right. Thank
I
you, Al.
can. Yeah.
Thank you. Thank you. So we went from a 70-30 split to a 20-80 split. Maybe I'm mildly effective, or maybe you just want me to stop talking. I don't know which one of the two, but I'm going to show you either way all the lean wastes that go into buying all those bulbs. So $14 of bulbs that you don't need for 10 years. Andrea, I'm going to toss this one to you. This is a softball, I hope, for you. What's that a lean waste of?
I'm so sorry. I have to admit, I didn't hear the question. My bad.
You bought $14 of bulbs. You only needed 4 bulbs.
Yeah.
And so the calculation on the price difference is you have to now store $14 of bulbs you don't need for 10 years.
Yes. Again, I have to pay more in rent. I'm paying rent in New York City. I cannot afford a bigger apartment, and a bigger enough apartment to go shopping at Costco every week. Not worth it. Like, absolutely can't afford it.
Do you know what lean waste is exemplified in this issue of storing $14 of bulbs for 10 years?
It's I don't. I'm sorry.
No problem. Phone a friend. I'm Khalil. I'll answer that one for you.
I see inventory from Jessica in the chat.
There we go. Thank you, Jessica. That's
Thank
inventory.
you.
We got excess from Shemay.
Excess.
Yeah.
Yeah. Thank you, Dennis.
So, excuse me, Khalil. So
Yes.
are you saying that we all should like maybe cancel our BJ's or Costco membership?
Not necessarily. I think it depends upon you. I'm saying my thinking is now informed differently. I go to Costco, by the way, probably twice a month, and it's just me and my wife in a household of 2. But also we have a giant house, and so storage is not an issue. And also when you think about, and I don't mean for this to be like a financial thing, but when manufacturing companies think about excess inventory, they think about what's the cost for 100 widgets to be tied up when we're not selling them. So what's the cost of like that toilet paper that I bought in jumbo size that could have been like, I'm not putting that money into the market. I could have survived without it. I'm not going to buy like 1,000 roll of toilet paper though. If toilet paper is on sale at Costco, I'm not going to buy 20 because then that's a waste. So that's my sort of in-between answer, Dennis.
Until the next pandemic hits.
But I also think, Khalil, I also think that Costco or BJ's, which is what we have near me, there are certain products, if you're analyzing it, that makes sense to buy in bulk, and certain products that you're like, not at all. And I
Sure.
think everyone got excited initially, the Costco BJ's, ooh, ooh, ooh. And then as you go more, if you make it part of your routine, you are analyzing, well, wait a minute, I don't need 800 cans of black beans because I'm really saving maybe 3 cents and I'd rather get them somewhere else. I don't have anywhere to store them.
Beautiful. And then you're leading me into my next one. That 800 cans of black beans is like a 24 pack of bulbs. What happens if they're terrible? Now you got to deal with defects.
Right.
By the way, there actually is a way, and I wish I had taken a picture. We use Kanban cards in my house to figure out when to reorder things. You're never stuck saying, oh, where's that last roll of toilet paper? You slap a sign on the last 6-pack of toilet paper saying, go buy more at Costco, and then it goes on the list. So just in time, I don't ever have to think about it, right? It's about making the process serve you. This is lean. Lean is simple. And I hope you're also now saying lean is simple, in which case, yes, you have bought yourself an advance ticket to the complicated lean TA call, which is, not yet scheduled. I have to move the bulbs from apartment to apartment. This is me in my old world. That's transportation. When you're moving supplies or people, that's excess transportation. And then because I'm a budget guy, I went for the budget movers. 30 of them broke in transit. It's defects. Here's the favorite one. I say this is almost last. We have 2 more to get through. We're going to go through 9 and 10, but this is the one that people absolutely love. So if you haven't been paying attention, this is the time to pay attention.
Sorry, Khalil, before you move to the next one,
Yeah.
with the bulbs, you could die before you use them all. Is there a lean thing for that?
Yeah, that's excess inventory. Yeah, because those new bulbs last 10 years.
Yeah, I'm all about inventory. Sorry.
This is a great example of how our thinking is archaic, right? We're so used to doing things the way we used to be doing. This is actually a good analogy for what's like in the Ryan White world. Oh, we've just been doing things that way. Oh, it's just the way we've always done things. Oh yeah, because Dr. Smith said so. Oh, because the nurse care manager told me that's just the way it is. So the reason why I taught you those 8 wastes is because then you can start to recognize. Sometimes it's just that's the way it is. Why do I have to do all this measurement? Well, it's because it's an important part of the Ryan White program. Why do I have to do this? Well, because the government requires it, right? My local health department requires me to check that this person's ID matches who they are because it's a risk management thing. Sometimes there's
Khalil,
requirements.
Khalil, this is Al. It sounds like it's people are resistant to change sometimes,
Yeah.
and you have to move with what is changing, and if otherwise you're not staying relevant for what's actually the need is.
Yeah.
So I mean, I like what I'm hearing from you. And like one of the other colleagues here said, it sounds like we're doing some of this stuff, but it just kind of puts it in perspective now. And like you said, you have to be relevant, and you do have to challenge HRSA sometimes. I mean, I've worked
Oh,
I've worked with for HRSA for I mean I've worked in Ryan White grants for almost 25 years now, and sometimes you have to challenge them on that, and that is how to make it lean, because sometimes what they put down the pipe, it doesn't make a lot of sense, and you have to make it make more sense and fit it into how can we be more effective.
yeah, that's a good point, Al. There's two thoughts I want to close this with. One is that when you learn to see things this way, like why are we not open on nights and weekends for our customers? We want to serve really vulnerable folks, but we're only open during the day, and we wonder why they don't come to clinic. Or we don't really offer a lot of telework, telehealth, and we wonder why we're not capturing all of our vulnerable patients. We don't text or Instagram or DM our vulnerable patients, and we wonder why they don't. Oh, because they have to come just the way we've been doing it. So when you recognize that way of thinking and recognize that it's a waste, it's overproduction, and you teach other people this way of thinking, they'll also recognize it. Sometimes it's just the way it is. To Al's point, there's a thing in lean called value added, non-value added. Non-value added is waste, and then there's non-value added business requirements. I don't want to have to sign in every day when I go to work. It's a waste of my time and energy and motion using that ink to sign my name. But my job requires that I do it. So sometimes there are just like requirements that are technically non-value added, but they are the way they are. And yeah, that's all I'll say about that.
So in the chat, Jamie Rogers mentioned that in nursing, they call that sacred cow or scared. Yeah.
Sacred, I'm sorry.
Okay. I wasn't sure if it was scared or sacred. So I
No,
was just-
sacred cow. It's the concept of the sacred cow, where you go in for quality improvement. And there's been a lot of articles about it in nursing, where you go back to try to change things. Oh, no, that's the way we've always done it. And people just are holding on to that sacred cow, instead of looking what is really the evidence based to doing it a different way.
Love it. Thank you for sharing that, Jamie. I like that there's a name for it.
If I can add to that, we find that sometimes HRSA doesn't change things until somebody challenges them and lets them know there may be a more efficient way, but they just haven't found it yet. And each one of us that are on this call could be the person that makes that challenge and says, hey, how can we make an improvement? And it may start with making those changes and get rid of that sacred cow kind of thing. So.
Yeah, process improvement goes up and down. So you guys are effectively in the middle, right? Up towards your funders and down towards customers that are being served. So process improvement is a 360-degree opportunity. This is the favorite one, so I'm going to jump to it because I want to make sure I have enough time. And then there's a couple other too. I used to spend a lot of time, and I'm a terrible business writer. You can tell maybe I'm decent at speaking. Writing is not my skill set, especially business writing. And I would spend a lot of time writing these. You can see this. Dear Shay, thank you. I hope you're having a wonderful day. Thank you so much for your blah, 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 blah. And business writing aside, this would take me a long time. And I would spend, and I calculated it, 5 business days a year writing the same emails. It's an example of overprocessing. Again, my coaching sites are not paying for me to write these big flowery emails. And it's a waste of my human potential. I could be saying, quiero dos tacos instead of just, mi nombre es Khalil. I could be expanding my Spanish. And so then I said, okay, how do I make this quicker? I would search for previous examples. Site visit has attachment. Yes, I'm waiting for Outlook to load. I got a gazillion emails. It's taking forever. The server's slow. I would go back and change the name here. Like instead of saying Dear Shay, I'd say Dear LaQuanta, but then I'd forget to change the organization name. Oof, oh no, not that again. And they're like, where's that recall email button? So here's what I did. Again, there's this idea of just in time. There's a fancy name for it, but this is really what it is. In your signature box, you can make templates and signatures. And I would make them for, you could see I used to run a book club. I used to take over other coaches' sites and I used to do summaries and then first emails to QIPs, quality improvement projects. And I noticed I wrote the same emails over and over again. So I just templated them. And I knew exactly what I needed to replace because of visual control. I underlined everything. Hope you're saying it in your head or out loud, Khalil, that is so simple. That's like silly simple. It's yes, that is the answer. Lean is simple. I knew exactly what to replace. All my information was there just in time. I had visual control. It was super simple. I took, and again, more importantly, coming back to that COVID, and I hate the USBs and setting up my desk, I took a task that I disliked, I wasn't good at, and I made it a lot easier. So coming back to Mark's earlier comment of how do you get people to get buying into quality? What are the pebbles in your shoe? Talk to people. What are the everyday little things that sort of tick you off? Find those and improve them with lean, and you will get quality converts. They may not identify as quality converts, and you don't necessarily teach them the 8 ways. You all are quality gurus, so I taught you the 8 ways, but you don't come with the 8 ways to people. You go and say, what are the pebbles in your shoe? Here's a lean way to improve that process that sort of drags you down. Pre-COVID, before we were all virtual, this is how I used to visualize my work. I'd have them sorted by category: to do, in progress, and done, low priority and high priority. I'd have them color coded by category. So this was for Billy, this was for Bob, this was for Sally, or whatever project I was working on. And me, my boss, my team could come by at any point and say, what's Khalil working on? This is how I manage my one-on-ones right now with my boss in my current job. You can see my boss to do, me to do. There's a bunch of other views, and this is not like a tech solution Airtable idea, but the whole idea is high priority, low priority. When are things due? You can sort things by category. You can easily visualize and surface the vital few. Forget about the noise and all these other things that are low priority that we don't care about, that are just FYI. I want to get those out of the way. I just want my work plan to be focused on what's most important to me. Here's how it can look as a roadmap for a team. Here's sort of 2 split out examples. Here's week 1, week 2, week 3 for a team. Where you can see here's like what an example of a 2-year roadmap would look like. If you were doing physical in-person huddles, you can build these electronically too. Here's a check mark. I know it's done. The team can celebrate. Here's my last example. This is from IHI. It's on visual huddles, visual management boards. This is in and of itself as a whole other, how to develop and implement these is a whole other hour-long idea. But you can see here, what's our mission? It's to do this. We here at the Ryan White, FQHC, whatever, our mission is to do X. Here's what we're doing today. Do I even have to read this? Visual control, green, red, yellow. I know where I need to spend my attention. I need to focus on these reds. Here are my 4 KPIs. These might be viral load suppression or linkage to care, whatever you're working on. Here's the staff. Here's their schedules and to do. We know whether something's done. Can you tell that this black circle has been done and the white one isn't done, and the halfway done something else is going on? You can easily visually assess. And this is human potential, making sure that there's a place for good ideas to live on beyond Chris in one meeting saying, oh, I think we should do that. And like it gets dropped by the wayside. Just under the wire of 60 minutes, we covered what lean is. It's the elimination of waste. We learned about the 8 lean wastes. There's no post quiz for the 8 lean wastes, don't stress. But I hope it helped you understand a little bit more of how those 10 plus examples of improving those pebbles in your shoe really are connected back to a defined approach to quality.
LaQuanta has a question, I think.
Yeah, LaQuanta, jump on in.
Finish your summary, Khalil. It can wait.
Okay, here's my challenge to you. I want you to walk out of this meeting and make 1 2-second improvement by tomorrow. Fix your USB situation at work. Lean out how you make tea in the morning. 5S, 1 drawer in your desk. Do it by tomorrow and share it back with me. My email's at the end of this chat. Make just literally 1. How simple is lean? You saw how simple it is. Do not wait. Make 1 improvement by tomorrow and send me an email. Next steps, there's an intermediate learning lab that myself, an amazing coach called Susan Weigel and Justin Britannic are leading. Shay and Andrea have more information if you're interested. And then here's a few books. The first one is my sort of book. It's Lean for Dummies. It's called 2-Second Lean. It's exactly what I just talked about, the pebbles in your shoe. How do I make life as easy as possible? Here's my email address. I do, like I told you before, interrupt me, ask me questions. I want you to send me an email with 1 2-second improvement you made by tomorrow. That's a challenge I offer each and every one of you. Thank you all so much. And LaQuanta, anybody else questions? And also, I don't know, we're at time, Shay, if you want to launch the evaluation poll.
I know we're just a quick thank you, Khalil, for that. I have one comment and then I have a quick question. So my comment is, you asked at the beginning of the presentation, how do you get buy-in? And I will tell you that for some organizations, it's hard to get buy-in to culture, because I remember working at this one particular hospital where they talked about just culture and they preached it and said that they were about just culture. But as soon as there was a safety report that came in, the finger started pointing at people. And so in those situations, I think it's kind of hard to get others to buy in, because they feel like, okay, the culture really isn't what they say it is at the end of the day. So that's my one comment. The question though is, I can see how lean could be easily applied to Part C and D, especially in the clinical settings. But can you give one example or one of those lean principles that may be more prevalent in like a Part A or a Part B, where the work is really, at a policy level, it's at a higher level than a direct services level?
100%. I'm going to cheat and go back to what I already showed you, because I worked at a Part A, Part B recipient for a period of time. That Kanban board that you saw taped on my desk was at my desk of how I managed my work. That roadmap is what we could have done for revising our business model for Ryan White. DC moved from fee for service to fee for value and piloted it for a few service categories. We could have done our roadmap that way. Site visits, you saw how that worked. So imagine scaling that solution to quality improvement coaches, grant monitors, project officers, making their lives a lot easier. Imagine if you made a visual control spreadsheet over what deliverables have been sent every month from your grantees and what you're remaining. So you don't have to have some big huddle in a meeting. Everyone puts their information into one big thing, and you just look back at the board and say, oh yeah, these are red, they haven't been submitted, these have been green.
Right, and I get that. I think for me it's hard, because I always think of things in terms of what I call P-CHOPS. How am I really effectively doing, changing patient care, health outcomes, patient satisfaction? Because at the end of the day, quality improvement really in the Ryan White program really is to affect one, if not all three of those. So that's it's just something on my brain, and maybe we can have a sidebar one day. I can hop on one of the check-in calls with Chris to talk more about it.
Yeah, and if you have Chris as a QI guy in your corner, you're very lucky. Chris is a smart guy.
I know he is.
Yeah. So yeah, there are some other answers. I would again cheat a little bit and say the fact that if you implement those things, and you'd probably find at least 20 to 30% savings in your process, at least if you were to effectively implement them. That's 20 to 30% more time that project officers and grant monitors can get out of a QC QA mode and start thinking QI. And it also just helps build the culture too. There's sort of an intangible aspect to, now these folks are thinking about quality and how they work themselves, and they're more likely to be good partners when you want to scale quality within a grantee. So you're doing some sort of lean project with a subrecipient, and your grant monitor and project officer is on board, as opposed to someone's experience whose name is Balil, who worked at a health department and who didn't really find quality advocates in the PO and GM side. And I see my fantastic colleague and friend Justin Britannic is here and has a question. Thank you, Justin. Or maybe a response that I butchered.
No, I was just going to say another thing too is these kind of small improvements, they lead up to those improvements in patient health outcomes, satisfaction, service delivery over time. That we can't innovate without having that strong base, right? It's trying to build a skyscraper on quick improvements is a great way to.
Oh no, I think we lost.
Yeah, I think we lost Justin.
I'm going to share these results just to be accountable to you all in this training. I got some great feedback. Thank you for sharing that with me. I got some work to do. I did not deliver perfect value to my customers, so opportunity for next time.
You did a great job though, Khalil. Thank you so much.
Don't let the perfect be the enemy of the good.
There you go. There you go. And much thanks to everyone for joining. Thank you. Khalil, you did a wonderful job. Thanks.